Yeah. Hi, students. I'm Dr. Badrinath, and in this video, we will see the first pass metabolism. First pass. First pass. So in the schools, in the school kids, they were asked, to their lecturers and all, first pass, not that pass. Okay, this pass is different. This pass is different. Comes in the biopharmaceutics subject. Okay, so very important topic, definite question for all competitive examinations as well as a regular examination, compulsory must and should topic, first pass metabolism. Why this name is called as a first pass metabolism means, so all the dosage forms, all the formulations what you are taking orally, swallowing orally, it enters into the liver first. It enters into the liver first, then only it enter into the systemic circulation. So before entry into the systemic circulation, all the medications what you are taking orally, swallowing orally, must pass through the liver first. Liver must. That's why what happen in the liver, most of the drugs will be metabolized. Almost 20%, 30%, 50% of the drugs will be metabolized before entry into the systemic circulation. Just imagine, that is the main problem of the this one. Okay, see here, that's why I made the liver first pass. It enters into the liver. All the whatever you are taking, whatever orally, swallowing is important. Oral, that word is important. Yeah, now we will see. It's a very nice designed by the God. That is a GIT. It is a structure of the gastrointestinal tract. GIT. Here you can see this is the GIT. This is a oral mouth, and here capsule he is taking like that. This is a esophagus, stomach. From the stomach, a lumen, that is a small intestine, big intestine. Okay, large intestine. Okay, then followed by the rectum finally. This is the entire structure. See, this is the structure. Okay, this is a nice, very nice structure designed by the God. And here he put very important structure. One structure is there. What is that structure is, all the blood vessels, whatever coming from the stomach, whatever coming from the small intestine, whatever coming from the large intestine, all these blood vessels, first it passes to the liver, then only it enters into the systemic circulation. Here you can see the systemic circulation. See, this is the systemic circulation. So before entry into the systemic circulation, whatever you are taking orally, it must pass through the liver. Actually, this type of design is very excellent design, because whenever you are taking a food, we are taking a food orally, all the nutrients like vitamins, minerals, what you are taking even in excess also, whatever, it will be stored in the liver first. That's why the God has designed such a type of a very nice design, excellent design. Because liver is a storage of minerals, all the vitamins, everything, etc. It will be stored in the liver. Whenever our body required from liver, it slowly, that is a design. But what happened here in this concept, liver consists of a various metabolic enzymes. Liver is a metabolic organ. All the drugs will be metabolized in the liver only. That point you have to keep in your mind. Metabolic enzymes, all the drugs, whatever it may be, any allopathy medications, it will be metabolized, degraded. Drugs will be degraded in the liver. Okay, because it consists of all metabolic enzymes present in the liver, full of enzymes, liver. That is the main problem here. So when you are taking a food, it will be good. When you are taking a tablets or medicine, it works as a against, because most of the drug, 50%, 20%, 30% of the drug will be degraded in the liver. Here, then only the remaining part, whatever is there, that enter into the systemic circulation. This point you have to keep in your mind. This is the structure. This point you have to compulsory. This, if you remember this diagram, automatically the concept will go inside to you. Here there is a sublingual, there is a bypass is there. This is the first pass, blue color. This is the first pass, which is I have shown in the blue color. See here, this is a first pass. Blue color is a first pass. since it is passing first only, first to the liver. Whereas here bypass is also there. This route, buccal route, sublingual route, buccal tablets, sublingual tablets, and that means that the blood vessels which are connected to the buccal cavity, sublingual cavity, oral cavity, not the esophagus, stomach and all, only this part, buccal part, having a directly enter into the, they have a direct connection with the systemic circulation. That is a speciality. Okay, and at the same time, rectum also, we know that it is a storage of the fecal matter. The rectum also having a bypass directly, they have a blood vessels connection directly into the systemic circulation. This is a bypass. That's why this is called a bypass. Very, very important word in this video, bypass. It bypasses the first pass. This is a first pass. So see, there is no first pass. Sublingual, like a buccal tablets, sublingual tablets, all these if you are taking directly it enter into the systemic circulation. Okay, see like this. No first, so no drug will be degraded. Almost most of the drug will be entered into that. Here also in the rectum, suppositories you are taking dosage forms, so you are inserting into the rectum. We know very well it. So what happened? Here also the drug which is released from the suppository will enter directly into the systemic circulation. So these two are the exemption. That's why I used swallowing. If you are swallowing, then first pass will come. If you are not swallowing, only chewing, only in the buccal cavity like sublingual tablets, directly it enters into the systemic circulation. All suppositories directly enter into the systemic circulation. So except the first part and last part. First and last, remaining entire thing must pass through the liver. So this is the concept. All the blood vessels from GIT, the same what I have explained, same thing in the running matter. All the blood vessels from the GIT except the buccal and rectal are mandatorily passing through the liver. Hence orally swallowing formulation, swallowing food, including food also, must pass through the liver first before entry into the systemic circulation. Hence, the drug will be metabolized in the liver. So, most of the drugs like 20%, 30%, that depends upon the drug, how much it will be degraded. Okay, it will metabolize it in the liver. So, and then only it enter into the systemic circulation. What is the meaning of bypass? I told no bypass. Here it bypasses. See, it bypassing the liver, this route. And this route also, rectum route also bypassing. What is this bypass? This is bypass surgery, very famous we are going. No? What happened in the bypass surgery? See, there was a blockage here. If there is a blockage, there is no blood supply to the remaining part of the heart here. So in such a cases, doctors will do bypass surgery. What is this bypass surgery? See, they are bypassing this. They are not going to repair this. They are taking extra blood vessel from the leg or extra blood vessel from the hand or mainly leg, from the leg, and they will join from here to here directly, here to here. So that what happened? Bypass. It bypassing the blockage. Bypassing. Here also see one blockage is there. The doctors what they do here also they made a one bypass. That's why this is called a bypass. So in our concept, it bypasses the liver, bypasses the first pass. Okay, here it is bypassing the block. Okay, yeah, this is a bypass route. This is very regular what we are using in our routes also. Kollam bypass route. This is, see here, it is a Kollam port is there, Kollam beach is there. It is a heavy traffic route. This route, what I am showing the arrow mark, see the pointer. This is a old route. Okay, from Mevaram to Alangmudu, Alattarmudu. This is a very old route. Very traffic. See here how much traffic is there. Very congested routes are there. Very congested. That's why what they do, government has planned bypass route. This is a bypass, new bypass. See the dotted line, new bypass. So we are bypassing the Kollam. From here to here, you are bypassing the Kollam. This is called a bypass real meaning. That's why bypass is the first pass metabolism. Like that you have to repeat. So equal words, synonyms, all are the synonyms. First pass metabolism is also called as a first pass effect, also called as a pre-systemic metabolism, because drug is metabolized in the liver before entry into the systemic circulation. Okay, pre, just like a prepaid, postpaid. Prepaid means before, so before metabolism is there. After that also secondary metabolism will be there. Again, it comes to the liver, and that is secondary thing. That it comes in the metabolism chapter. Okay, so first pass effect, pre-systemic metabolism, pre-systemic effect, hepatic first pass metabolism. Hepatic means liver, we know very well. So in the liver it is metabolized. Hepatic first pass effect, don't get confusion, don't confuse your mind. Okay, which route shows the first pass? Oral route. Oral route is the main route. Main drawback of the first oral route drawback is the first pass metabolism. That's why here I have mentioned, see, oral route first pass metabolism, except to the sublingual route buccal formulations. Okay, that point very, very important. That's why as possible you prepare the buccal tablets instead of swallowing a tablet. With a less dose we can do. Rectal route, no first pass. Suppositories, example. All transdermal routes, transdermal patches, okay, example, no first pass. All parenteral route, IM injection, IV injection, what, it also not at all related to the first pass metabolism. IV route, IA route, subcutaneous route, intramuscular route, no first pass for all. Okay. Yeah, here you can see the matter. It is a process definition. It is a process in which the drug is administered by the mouth, is absorbed from gastrointestinal tract and transported via the portal vein, via the liver, portal vein to the liver, where it is metabolized. As a result, only a small proportion of the active drug reaches to the systemic circulation. First pass metabolism can be bypassed by giving the drug via the sublingual route or buccal route. You can use if you want, the same matter only. Example, number of drugs are there, they have a very significant potential, nearly 50 to 50, not only 50%, 60-70% of the drug will be wasted in the liver itself first. Main biggest drawback. For example, imipramine, these are very important. Imipramine, morphine, propranolol, diazepam, midazolam, cimetidine, lidocaine, all these shows significant first pass, not first pass. Almost all the drugs shows the first pass. Significantly it shows. So we can reduce the dose also if you know this one. See here. Propranolol, I already told the example here. I took here. Propranolol, conventional oral swallowing tablet. Propranolol, 30 mg tablet is available. Okay, what happens if you are taking it? In the liver, 50 mg will be wasted, metabolized in the first pass. Only 15 mg will reach us to the systemic circulation. Now, what you have to do by using your brain, okay, you prepare the propranolol buccal tablets, which is placed in the buccal cavity. Only you prepare 15 mg only, not the 30 mg. Directly all the drug, most of the drug will be entered into the systemic circulation. Need not, see, dose is reduced by half. Tablet price is reduced by half. Company shares will be increased like anything because you reduced the cost like that. You use your brain. Okay. Yeah, dose consideration, same only. Drugs with high first pass effects have a considerably higher oral dose than the sublingual and parenteral routes. Okay, that's why orally we are taking a big tablet you have to take. If you are taking in another route, small thing is enough. There is a marked individual variation in the oral dose due to the differences in the extent of the first pass metabolism. Marked variation, not small. See, 50% is a marked variation for propranolol. Okay, yeah, I see here this route, here I showed a diagram. Still very clear diagram it is there. See here, rectal route having a direct link with the heart. Rectal route. See here. Okay, rectal route. And orally, see, inhalations and the injections, intramuscular injection, IV injections, all enter directly into the systemic circulation. Inhalation, buccal tablet, chewable tablet, see, sublingual tablet, see, all they have a very good connection. See here, see, all these they have a very good connection with the directly into the systemic circulation. Whereas only see here, blood vessels from the stomach, blood vessel from the small intestine, blood vessel from the large intestine, all these they have a connection to the liver only. See, it is passing through the liver. Here only first metabolism will happen. This is the concept of the first metabolism. It is important for all paramedical staff. It is important, right? So I will end my session here.